When people have a physical illness, we know it's important they get the care they need. But if it's a mental illness, we often don't know what to tell them or where they should go for help. We tend to separate physical health from mental health, but both are essential to our overall well-being. We need to change the way we think about mental health. The Department of Health is integrating mental health with primary care. Our goal is to make mental health care easy to access for everyone, as early as possible, outside of a hospital setting.
Adults with serious mental illness die 25 years before any of us. Why is that? What can we do to change? And look at ways we can combine and integrate and align the physical health care system and the behavioral health care system. I think that's a new frontier.
The change process is starting at the top. Governor David Ige supports an integrated plan to rebuild Hawaii's mental health system.
We know that mental health can impact the physical being. We really are making efforts to rebuild the infrastructure for mental health services.
One of the major goals of the Department of Health in 2016 was to start the process to build a new forensic hospital building. With the support of Hawaii's legislators and the governor's office, $160 million was allocated for a new building to replace the now demolished Goddard building.
It's going to be another 4 years before that hospital is built. In the meantime, if we get individuals and get them stabilized, get them the help that they need, fewer and fewer people, hopefully over time, that will need to be in the hospital.
A few years ago, the access line would receive so many calls that some would be missed, or people would hang up because they couldn't get through. The service was renamed the Crisis Line and refocused its attention to helping those most in need.
Because we service the entire state, a lot of them are rural areas that don't have a lot of access. They don't have finances, so a lot of them are homeless. They've been either alienated from their families, don't have a lot of social networks to provide that support, so we're actually the only other person that will have a conversation with them and make that connection.
There is more work to be done in this area, but the Department of Health is leading the way. Be sure to see the other videos about how the Hawaii Department of Health is working to improve our health. You can view the complete strategic plan and other videos by going to the Department of Health's website and clicking on the About DOH tab.